is a 55-year-old bus mechanic, had an injury at work, and his arm essentially kind of jerked, and he ruptured his pec major tendon. So I'm going to go ahead and just do an ultrasound, focusing on the pec major muscle.
Here we're going to go ahead and look at the biceps tendon in short access. Note how the biceps tendon is not firmly snug against the humeral shaft because of this pectoralis major tendon tear. Here we're looking at the biceps tendon. You can already appreciate how it's lifted out of that sulcus or out of that bicipital groove. Again, it doesn't have the pectoralis major tendon stabilizing it towards that humeral shaft. Here you can appreciate that it's basically medially subluxed to a degree, and again off the humeral shaft because of this tendon tear. Essentially there's bowstringing of the biceps tendon. Here we're just going down the arm, and now we're starting to get into this actual rupture of the pec major tendon, which you can see here. There's hyperechoic irregular tendon stump. There's some overlying musculature which you can appreciate as well. And essentially to the left of this stump you got this hematoma. I think there's some muscle fibers intermixed with that, as well as some organization of the hematoma. A little bit difficult to decipher out between those two. And now we're going to switch gears and look at the biceps tendon in long axis. So the probe will be in an anterior sagittal plane over the arm. And here you can appreciate that fibular structure, which is the biceps tendon, but it's really not very close to the humeral shaft. Again, there's essentially bowstringing of the biceps tendon, as the pec major tendon is not there to keep it close to the humeral shaft. Here again we can see the pectoralis major stump. Now we're looking at the pectoralis major stump essentially in short axis. So we're looking at the muscle of the pec major as well as the pec major tendon in a short axis view. This is in an anterior sagittal plane. So even though this is long axis to the biceps tendon, it's actually short axis to the pectoralis major tendon. And here's where we go a little bit more medially. The underlying muscle below the pectoralis major muscle would be the pec minor muscle. Here we're going a little bit further down the arm. We're starting to actually get into the biceps musculature. And here you can see the biceps brachii short head muscle, which is underneath both the pectoralis major and deltoid muscle. And here again you can see that pec major tendon in a short axis view. Now we're going to have an axial oblique view of the pectoralis major muscle and the tendon stump. So here we are basically in line with the fibers of the pec major, and basically we can see this tendon stump now on the left side of the screen. You can see overlying pec major muscle fibers. And again, you can see this hematoma with likely organization, and I think a fair amount of residual fibers of the muscle within that as well. So it's a little difficult to decipher. So that's basically highlighted in the dark red color. You can see the surrounding hematoma around that. Here now, as you go laterally, you can start actually seeing the biceps musculature, both the long and the short head. So the long head is lateral, short head medial. And here again, we're looking at that tear in the pec major muscle. You can see the tendon stump. And again, here's a pretty good view of the stump where essentially there's recoil of that tendon. Here we're going to go over an anatomical model of this patient's pectoralis major tendon tear. Here we're looking at the pectoralis major muscle without the rib cage. You can see the relationship between the pectoralis musculature as well as the rotator cuff musculature. Here we're looking at the underbelly of the pec major muscle. You can see the pec minor muscle with some of the fascia removed. And now we're again going anteriorly. Notice how the pec major muscle goes over the biceps musculature. And again, here's a bird's eye view of the deltoid muscle and rotator cuff musculature. And you can appreciate how the deltoid muscle is one of the attachments of the scapula and essentially the humerus to the axial skeleton via the clavicle. Now we're taking away the fascia from the pectoralis major musculature, and we're showing what this full thickness pectoralis major tendon tear looks like, essentially, where there's retraction of the tendon and it's going essentially medially over the biceps musculature. Now we're bringing the normal pectoralis major muscle back to view. And one thing not demonstrated in this video is the bowstring or the biceps brachii long head tendon, which we can see in the ultrasound. And here you can see this in an axial MRI of the patient, where you can see the biceps brachii long head tendon lifted off the humeral shaft. Again, you would expect this closer to the humeral shaft, as it would normally be held in place by the pectoralis major tendon. And you can appreciate here rupture of the pectoralis major tendon with recoil of the tendon and muscle. And again, you're losing that sleeve effect, essentially the pectoralis major tendon, which normally sits over the biceps brachii long head tendon. And with that sleeve effect in place, you would expect the biceps brachii long head tendon to be just in that bicipital groove on top of the humeral shaft.